Going forward, I also want to acknowledge that we will be recording this session. So I hope, and I hope that all of us are okay if we record this session. Just to take us quickly through our roundtable expectations, we have a few expectations that we want to share with whoever is in this session, just to make this a bit interesting. It's important that you use the hand raise function when you'd like to contribute to the session. Feel free to use the chat function to agree and build upon the contributions of the person speaking. We are advised to mute our microphones when we are not speaking to limit the background noise. It would be wonderful to see your faces, but if it's not feasible, please turn off your camera, because we know sometimes the connection is different in different places and it keeps on shifting. Please limit individual comments to 1 or 2 minutes to allow other participants to at least to be able to share, to have a chance to share. And let's stay on topic. It's an interesting topic, and I'm sure there's a lot to talk about. I don't even think that the time is enough. So we have very limited time, so let's try and stay on topic. And now turning back to the participants, those who have joined this interesting discussion. It would be nice if we would put our names on the chat box, your affiliation, where are you coming from, and your email address. If comfortable in sharing your email in the chat box, I think it's important that you do that. Let's get to the next session where we can be able to get to know where people are coming from. If you can move to the next slide, Kim. We would want to hear, to see where we are all coming from. So these Google Slides are going to help us do that. And it would be nice if you, at the top of your Zoom, where it's written few options, it's good to go there, click on annotate. Then click on stamp. I believe we are all there. Then click on the star. Then click your location on the map, and we'll all know where you're coming from. Like me, I come from Nairobi, Kenya. It's right there. So let's see where everyone else is coming from. Nice. We have people from, I'm not sure whether that is Uganda or DRC. I don't know where that is in the map, in the European map. Is that Judith?
Yes, that's the Netherlands.
Oh, that's the Netherlands. I almost guessed. I wasn't sure whether it's Netherlands or it's which other country. And we have a lot of people from the United States. I'm waiting for 8 stars. I'm only seeing 5. I see someone else is saying they're from in Sierra Leone, Uganda. I think they're put. Nice. Would I request if whoever is from another place who's left out, please, if you can put you locate yourself on the Google Slides, and then we'll know where you're all coming from. In the interest of time, Kim, I think it's good we move on. I want us to still use the same model that we've used for marking the stamp next to each item you believe counts as evidence. We are talking about, does data even count? If you believe that they all count as evidence, just put 1 check mark on all of the above. All this that is here, just go again up the way we have done for the map, and then we can be able to see what is what. Use it this time, don't use the star, use the check mark. Let me just here use a check mark. Like that. What counts as evidence? Is it opinion from leaders, personal testimonies? If it's all of the above, well and good. Great. I see many people are saying all of the above. Research studies, personal stories, all this counts as evidence. I don't think I can see another check mark. I think it's good. Thank you so much. I think now it's important that we get into the topic of today. And it's about the it's an open discussion, basically wanting to understand what exactly in our experience or opinions really counts as evidence in this session that we are in. And I'll ask a few questions I'll ask Kim, my co-facilitator, to really just pop them on the screen for us to really ask ourselves and just interrogate and ask and discuss and of course with opinion, with backings from your opinions, your comments. What exactly, why do you think the questions that I'm asking, or why do you think your answer is really the right answer? And there's no right or wrong. Let me not use that word. There's no right or wrong. And the first question I'm going to ask is personal experience of citizen-generated evidence as compelling to policymakers as traditional health and demographic data? Why or why not? I don't know whether, Kim, you can be able to put that on the screen or into the chat box, sorry. Is personal experience or citizen-generated evidence as compelling to policymakers as traditional health and demographic data? Why or why not? Happy to hear what your opinions are. As I said, it's an open discussion. Kim has put that question in the chat box, so if you cannot go to the chat box, and feel free to use to raise up your hand and let's discuss. Who wants to go first? The floor is open. Kim, would you check whether there's someone raising their hand? I don't know whether there is. If not, so I think we are a bit few. We can still just raise our hands and or indicate that you want to answer, then Kim will be able to pick that.
I'm not seeing any raised hands, but do just encourage people to come off mute. We are a small group.
Judith, do you want to go first?
Yeah, that's fine. I was writing already, but yeah, and I don't see the option to raise hands, but maybe oh yeah, I can see it now. It's in the participants part. It's always looking for where it is. Well, to me, this type of data is very valuable and very important, but I think to many decision makers, they do give preference to, you know, kind of the hard statistical data. So I think that it is really a matter of how to frame and sell your data and evidence to them to make it convincing. I think it's a little bit harder to put it out there as evidence.
Thank you, Judith. Who else has an opinion about that?
I'll jump in just for a second.
Yes, Rachel.
Hi, everyone. It's more of an opinion. It's not based on research, since we're talking about data. But I do think, I guess I would say that the two types of data or of information complement each other, because I think personal stories show the person behind the numbers. and behind the data. And I think that makes it it can make it very much more compelling. So you of course, I think you need to have the sort of hard numbers, but I think when you have, it's the complement of having the qualitative research to really understand what the numbers mean and to put a face to the numbers.
Thank you, Rachel. I think what you say is complements what Judith says. Basically, what I am hearing from both of you is that yes, the numbers are important because the quantitative element of it is important because they tell us they give a certain figure or they quantify something. But behind those numbers, what I'm hearing from you is that there's a story behind it, and that story, the lived experience, the realities are really what counts. And there is none of the qualitative or neither the quantitative or the qualitative release is big or small. They basically are important for each other because behind the numbers is a face, and behind the face there's a story. And that story is really what is really critical. I think that's what I'm hearing from both of you. I don't know whether it's someone else with a different opinion or with a similar opinion that they want to support. I'm almost feeling like calling on people like teachers did. Dr. Frank, what is your opinion from Sierra Leone?
Okay, thank you. Thank you, Angela. I think personally, I feel that evidence, citizen-generated evidence should be equally compelling to policymakers, just like the quantitative data. If you talk of health data, it's mainly you're talking of the numbers. If you talk of demographic data, we're mainly talking of the numbers, the age groups, the sex, the education levels, and so forth. So basically, to tell a true story, I'm in agreement with both speakers that have preceded me, that we then need to have a story behind those numbers. And those stories behind those numbers, some of the stories are mainly personal experiences in terms of, and also you find that if you look at personal experiences, there's actually rich in those qualitative information. So actually it is very important or crucially to complement the two. You can't run away from the qualitative data and focus mainly on the quantitative data. But you find that usually, traditionally, most people like the quantitative data, forgetting about, if you look at the health systems, for instance, what we are currently collecting on a routine basis is mainly quantitative, how many people have received certain services. And then we forget about going back and dig deeper, conduct some exit interviews, conduct some qualitative assessments, to really understand the stories behind those numbers. So I think that's my contribution to this.
Thank you, Dr. Frank, and thanks for jumping in even when I called you unawares. I would want to hear what Cornelia has to say. I really want to see, then before we move to the next question, which I think is almost similar to the question that we're just discussing. Cornelia, if you're there, would you give us your opinion on what you think? Do you think personal experiences or citizen-generated evidence is as compelling to policymakers as traditional health demographic data?
Hello.
Hi.
So I'm Cornelia from Samasha, and while we do a lot of advocacy, we have learned that the citizen-generated evidence speaks more to our policymakers, and also the use of our traditional data, because sometimes it's the statistics we have, because we use mainly the DHS and the information that comes through surveys. So it's because it is the most referred data source that we have, it is easily compelling. And then for the data, for the citizens' data, it gives it a human face to what is there, because we're able to have very many voices that are coming in to make us stand about something, compared to personal experience, which can be biased.
Thank you so much, Cornelia. And I think just maybe to sum up, because I am also of the similar opinion that experiences and citizen really generated evidence is really crucial. And I think that is something that I saw in our campaign that we carried out a few years ago, like 2 years ago, 1 year ago, basically asking citizens what quality means to them when it comes to reproductive health, vis-a-vis what quality meant to the service givers in the country. and across the countries that we work in as White Ribbon Alliance. And what we saw is that what is defined as quality by the experts, the supply side of the domain, is not what is actually dictated by, I mean, it's not the same expression by citizens. For citizens, something like respect, water, sanitation, and hygiene is really crucial for them. And yes, when you look at quality from the givers of care, it's something else, like the number of health workers being the topmost leading definition of quality and the like. So for me, I'm really of the school of thought that quality, I mean, citizen-generated data cannot really not be left out. Now, moving swiftly and to the second question of the day is, our opinions of trusted leaders, that is community, religious, or politicians, as compelling as traditional health and demographic data. Why or why not? We've talked about citizen-generated data. What I'm hearing from all of us is that it's very crucial. Is it the same thing like as data coming from our community leaders, opinion leaders, and even politicians or people who are really within our communities? Is it as compelling as demographic health surveys data? Who wants to go first? I don't want to call on Judith this time round. I want to see, I've seen we've had other people have joined, and welcome Elvis. I can't see everyone else, but I'm sure Sandra and others. And Kim has posted the question on the chat box. Are opinions of trusted leaders as compelling to policymakers as traditional health and demographic data? Sandra, do you want to take this first?
I hope you can hear me. Apologies for the background noise.
It's a lot of noise, Sandra, where you are.
Yeah. Maybe I can text my response if that's okay.
No problem.
I do have a response.
Go ahead and type it on the chat box. Who else wants to go? The floor is open. Dr. Frank.
Can you describe a little bit what you mean by trusted leaders? I'm thinking of some of the elections that have gone. Hi, greetings from Uganda. Think of some of the elections that have gone on recently.
Yeah, I think probably just to
thank you so much. I think for me, I want to remove the politician aspect of it. Let me talk about opinion leaders from the community leaders. Let me talk about like village elders or religious leaders and the like. I think that is a different group. Those are basically trusted leaders within the community. Let me leave the politicians outside because I also don't believe that they are really the trusted kind. So yeah, thank you, Kate, for that. Do you want to take it away?
I don't know. Anyway, greetings from Uganda. So I think this is a tricky one. And again, from the research side of things, trusted leaders, again, I'm sort of a bit thrown by that one, but I think that, you know, there is certainly value in the stories that can be told from folks that have are respected within a community and can influence upwards. And I think certainly as we talk about advocacy and through journalism and communication, that's where a story can really be developed. And through that story, then data can be woven into that as well. So that's just a general response to that one. And yes, and certainly it can address, and that's the second question. Yes, it can certainly, I think, be helped by including, you know, demographic and other, you know, even qualitative peer-reviewed data as well. Thanks.
Thank you, Kate. Thank you. Dr. Frank, were you saying something?
Yeah, I think you were talking about the policymakers, eh? And then
yes, trusted leaders within a community.
In the community, not the policy. Yes, yeah, but then I think what is also crucial is how would we have collected the data from them, because it also depends. If let's say it's a community gathering and they're talking about issues probably that are maybe, let's say, political in quotation marks, then that may also need to be taken with a pinch of salt. Mm-hmm. But then what I think is crucial is then if we are to, it depends on how we need to get the data from them. If it's properly structured, and you can also make use of that data to make decisions. So what I'm basically trying to say is that we can't just throw that data or information away. What can be crucial is that that information can actually be leveraged with other data to maybe to support effective tracking of certain interventions, or maybe there's something that is happening, or a project that is happening in their particular community, they need to make sure that whatever their voices, they are heard. But then the voices that then should be packaged in a way that can be usable in quotation marks, so that because ideally what we are saying, I'm saying is that citizen generated, they are also citizens, trusted leaders. So citizen generated data can actually tell a story in terms of whether a certain intervention is making an impact or not, or even if we are then to advocate for certain interventions or certain changes within their communities. Basically, we cannot advocate without including those trusted leaders. They play a crucial role, but then what is important, I think, is that they also need support from whoever is implementing the different programs or projects in their community, so that whatever they say is in line with what is supposed to be done.
Thank you, Frank. And I see Mary as an interesting comment. I don't know whether Mary would want to come and off mute and just talk a bit about it.
Yes, it's really an area that I'm very interested in, and I would like to have a lot more information about how it all works. But I know that monitoring social media messages using an algorithm, so you can monitor if comments are positive or negative about a certain topic. And so how I understand it's been done, there are two studies I know about, and one was on HIV messaging. So they provide messages, there's social behavior change messages, and then they look at people's social media messages before and after. So say Facebook or Instagram, I think, can be used. Twitter can be used, particularly Twitter. And they see if there's been a negative or a positive change. There was also with mask wearing, somebody did the same, use social media messaging to look at the people's attitudes towards mask wearing in many countries, across countries. And I don't know how it works. I'm just very interested in it. I'm currently trying to get us to do some research on it, and it's come up against some ethical issues, because this is primary data, it's public data, because Twitter, you can read it publicly, but it seems to be quite complicated in some countries with the ethical issues. So I was just wondering if anyone had any experience. I'm really interested in it.
Maybe Mary, I can come in and speak. Let me speak about the country that I know best, and that is Kenya. And I know that sometimes social media can have, there's a lot of information that can be found in social media, especially in our context. But sometimes I'm not sure it can be trusted, and I think that is why I think for reasons that are really quite political, because most of the people, or some of the people who drive the agendas, are actually paid by politicians to drive a certain agenda, which might not be the community agenda. And so in some countries, like we saw Uganda recently, as much as I would have wanted to be part and parcel and drive a conversation about how the elections were going on, this is me digressing to a different topic. But it's a topic that it's a social issue. There are topics that affect people, and social media was blocked. So it's a bit interesting. I think it depends on countries and contexts. But I think, as you're saying, it could be something that we can actually be able to get data on a certain issue. I don't know whether there's someone else who wants to chime in. But before they do that, I want to just react to what Sandra and Ronald have said. And Ronald, I hear you completely. There's some, as Kate was saying, I think there are some leaders who have their own individual agendas. They are opinion leaders in the community, but they could also be used negatively, or they have the individual agenda. So I think it's good to really to cross-check and actually triangulate that data with other community people to actually see whether that data, that's what I hear you saying. And I think what I hear Sandra saying is that sometimes communities and citizens, especially across many of the traditional, I mean, the African setup, let me speak about that, where I know best again. Many people do not consume the traditional data, and most of the time the data that is actually coming from secondary audience. And so it's what Sandra is saying is that it's important that we actually get direct data from individuals, the lived experiences of people. So thank you, Ronald and Sandra have taken note of the comments. I don't know whether there's someone else that wants to comment on that topic, but thank you. I think that's an interesting conversation, really, looking at opinion leaders on their negative and their positive side. And I think what I'm hearing from us is that we have to be careful. If we are going to get evidence from opinion leaders, we have to know what level of agenda do they have within the conversations that we are taking forward. Anyone else who wants to come in? The floor is open. We are only 12 of us, so feel free. Judy, I see you have a comment about social media data being quite interesting, but at the same time, you think lots of the discussions are polarized depending on the topic. Yeah, I think that there lies a bit of the challenge also. Sometimes some people, it becomes quite, it's really an issue that is really personal and really, yeah, they're passionate about an issue, then other people are really, so it becomes a hard place to really know whether that is the place. But I think, as I said, I think it's all about context. If there's no other question, or have I left out someone? Kim, are you there?
I am here.
You see a hand up or someone wants to speak? I might not be saying it.
I don't think the hand raise function is easy to find. Again, we're a pretty small group. I think this is going pretty well. Oh, sure. I would say I encourage all of you to just jump in if you have a question or a point, or if you want to take it in another direction. So
I was just going to add, sorry, Angela, if I think I haven't thought so much about traditional leaders or trusted leaders as data collectors or data, expressing their views on the, but I think they are really useful in terms of being a middle person and in terms of influencing, whether it's teen leaders or other trusted leaders, as people who the community trusts and who can convey messages to, if it's a religious leader or a community leader, or like I said, a teen leader, that they can really be key people in terms of talking to, their, I don't know if you want to call them constituents, but people who respect them and helping on that side of things. Thanks.
Thank you, Rachel. And Mary, I hear your point. I hear you. I think maybe we didn't quite get what you meant, and I think I get you from the chat.
Angela, Ronald does have his hand up.
Sorry?
Ronald has his hand up.
Oh, Ronald, go ahead.
Thank you so much. It's really a good deliberation. Thanks, Angela. I'm Ronald in Uganda. I will share my experience as a person who has stayed around central Uganda for some good time. The time I started following events, leaders were trusted so much in my area. However, with the trends, you realize people are more focused on monetary benefit, the money. So I know some of you might have had some experiences, say like from some of our church leaders in Uganda of recent, towards the election, the just concluded election. People we have trusted for the last 20 years coming up and giving views which are contrary to what most of the people believe in. Say things like extending the term limit. One of the church leaders, the Catholic church leader, came out and said, let's extend this term by 3 years. And when you look at most of the people around the country, what their view is, it's totally divergent from that. So when we try to follow up news that was being saturated on social media, people ended up saying that these people were being used by the leader of the country. So as I speak, I think the trust of our leaders, both the politicians and non-politicians, has really changed. So we may not trust the data so much, we may just take their view as an individual view. Thank you.
Thank you, Ronald. I think that is very clear. And I think, as I said earlier, I think it's all about context and what is going on at that time. I think it would be nice to hear what Mary, maybe Mary wanted to exactly to say before we move to the next question. Kim, is there another hand that I can't see?
No other hands at this point.
Yes, Mary.
What I meant was, say you have a group of you have teenagers. They talk to each other on social media. They use Facebook or they use WhatsApp. You can't use WhatsApp, I think, for say they use Facebook, they use WhatsApp. They talk to each other on social media and they use certain terms. So what I understand from the HIV work, they use term, say for unprotected sex, they would talk about bareback sex. And then there would be, the algorithm could judge if that was a positive or a negative. So they sentence, comment. So, so were the teenagers like proud that they were having bareback sex or unprotected sex, or were they saying, oh, it's a bit, you have to be careful? What were the messages? So with family planning, are teenagers saying, well, I went to the facility and the provider was rude, so I went away? Were they saying I went there and I couldn't get the supplies? What are they talking about? And then use those messages of what they're talking about to see if things are changing. You provide a message, you provide more facilities. That I think we had a session yesterday where they were saying there was a Google Maps where teenagers could find, they could go online and find where the services were. And then, so if you provided that service and then you followed what people were talking to each other about, it's almost like being in the room with them, and you can access those messages, not by individual, but just with an algorithm. Like you have hundreds and thousands of messages, and then you work out with an algorithm if it's positive or negative. That's how I understand people this is used. I find it really interesting. As I said, I don't know enough. I don't know any more about it than that.
I think it's something worth following up. I think it's a worth. I've not heard about it, but I think what you described is something that is worth. But I think it will need time and investment to actually just follow through and find out what exactly is being spoken. Thank you, Mary. And I know we are running out of time. I want us to move to the third question. And this question is about the evidence and donors. And the question reads, and maybe Kim, you need to put it on the chat box. What type of evidence generation for family planning should donors invest in? What specifically can or should they support that would be helpful? I know family planning is one of the elements of reproductive health that has been funded for the longest time by donors. And we are discussing different types of evidence in this session, whether the numbers or the qualitative, the stories and testimonials. What type of evidence generation for family planning should donors invest in? According to your view, what do you think needs to be invested in? What should they support? Should they go ahead and keep supporting what they were supporting previously? Or do you think as times have changed that they need to change what they support and what could be helpful to them? Who wants to go first? Judith, I've not heard your voice in a long time. Are you still there?
I'm there. I was actually typing. So my first thinking was investment in longitudinal data. And particularly panel data. It's very difficult to follow up people, from For example, when you talk about sexual development from a young age up to the 20, 25, 30 years old, it's very difficult to really do that with panel data. So multiple cross sections once every 5 years, that is kind of doable to find new funders, but really to follow up with panel, that's one of the things that I was thinking of.
Thank you, Judith, for being ready even when I called you. Kate. Now I know everyone in this panel. I'll call everybody.
Right. So the first thing that sort of came to my mind, and something that we're struggling within our programs in terms of evaluating, is comprehensive sexuality education. So addressing our adolescent and youth and determining, what really works and what doesn't. And there's complexities in terms of the research methodology related to that, as well as, ensuring that within the different countries where we operate, that there is sufficient advocacy behind changing the current level of what is being, the current CSE that's being provided within schools, and ensuring that is tailored towards different age cohorts as well, and addressing also how do you measure this for adolescents that may not be in school as well. So that for me is a biggie, because I think if we can try to address this among our adolescent and youth populations and measure the success of how well CSE is being implemented, can help to really improve our impact. Thank you.
Thank you, Kate. That's really... Who is next? Dr. Frank, are you there?
Yeah, yes, I'm here. I think Katie summarized everything. She has actually done a very good job. But I think maybe to add to what Katie said, I think it's also what is important also to look at the method mix in terms of the preferences. Because we find that in some cases, people end up getting certain type of family planning bodies because that's what is available. So I think probably there's need to bring in the element of rights as well, sexual rights, where we are also considering what they think probably is best for them. If we look at adolescents, for instance, what would be the best method for them, probably as compared to the other. So those are some of the things that also probably needs to be taken into consideration, especially moving forward, rather than maybe focusing on the traditional, family planning methods that has been in existence for quite a long time. Yeah, things are moving. There's also like issues to do with self-injectable commodities, which are probably have started rolled out in some countries. But then there's also need to look at issues to do with safety. And I cannot probably also ever emphasize on that. I know there are side effects that probably come in with each and every commodity or family planning method, but then it brings in the element of sexuality education that I think someone has alluded to, that there's need for comprehensive sexuality education so that people make a choice based on what they would have been given, in terms of education. I think that's probably my 2 cents.
Thank you, Frank. I want to get a bit, let me say for lack of a better word, controversial. For the longest time, I think what we've been hearing is that we have been hearing pushes coming from either the programmers or the donors that we need to invest more in long-acting and permanent methods. We need to invest in this method and this method. And the question that I keep on asking myself sometimes is, who decides? Who decides what people need? Who decides? And don't you think that donors, and this is a question that I'm pushing over to you, don't you think that donors should invest in listening to what people actually want? Sometimes you might be thinking people want a permanent method of family planning. Whose agenda is it really the agenda that should be funded? Is it the donor agenda? Is it the programmer's agenda? Or is it the people's agenda, the women and girls? So I would want to hear your views. Whose agenda should we be thinking about? What evidence should we be looking for? Should we be looking for evidence after we invested in what we think is what people need or women and girls need? Or should the investment be in finding out what do girls and women need in terms of family planning before we can actually decide what we want to invest in? I would want to hear your views, because that has always been my I'm always conflicted in exactly, what exactly, whose agenda? Happy to hear from anyone with my view. Ronald, go ahead.
Thank you, Angela. I believe that the previous methods of getting evidence somehow didn't put the beneficiary into the driving seat. So as we collect evidence, my idea is that we begin, even before the implementation, we begin by involving the potential beneficiaries. So if we invest in that co-creation activity, bring together a sample set of the people who are in the community that you are targeting to intervene in, they give us evidence. That would be one of the good ways of investing. And also another idea I'm having, when you begin, say, assuming you are giving health services, we need to have more time systems that can capture information, data more timely. Say when the doctor is giving a service to a girl out there who has come for a family planning method, we need to invest more in those systems that can enable capture information there, such that it informs our programming and program improvement. Thank you.
Thank you so much, Ronald. Someone else? Anyone with an opinion? Let me not say with a different opinion, but with an opinion.
Hi, Angela and everyone.
Yes, Rachel.
If I can jump in again. I wanted to, I agree with you, Angela, that the view should, the direction should come from people who are the beneficiaries, the users. I don't like the term beneficiary, but the people who would be using whatever contraceptive method is best for them. They should be the people to decide. But I think it's a little bit more complicated, because I think they need to also have full information on what the benefits and disadvantages of each type of method are. And I also wanted to follow up a little bit on what Dr. Frank was saying. Just, I think a lot of what the discussion today has been around is on the users and their needs and concerns, or the data related to the users. And I know from, I mean, I've been involved in a couple of studies looking at the providers, and I think we also really need to look at the providers of family planning, contraception, because it's also what methods they have available to offer, what methods they feel comfortable offering in terms of just the actual physical part of it, but also what methods they feel comfortable providing and offering based on who they see as their clients. And I think it's not just a question of what people want, but also what is available to them and what is being offered to them in a non-judgmental or genuine way. And so I think that really forms a big part of the equation, and a big part of where we need to collect data and then use that data to respond so that all, so that people can receive all of the information and make their own decision about what is best, for them personally.
Thank you, Rachel. I think what you say is something that I observed a few years ago when I was a practicing midwife, and sometimes the investments do not take into consideration even the context and the cultures of people and the values that those people hold. So I wonder whether sometimes it's important to just invest in establishing what exactly are the values and the culture that really speaks to those people, that before you introduce a family planning method, you could actually, because sometimes some places you introduce methods that will never be picked because, of course, of some underlying context and culture and the like. I see that we have, I see we have less than 10 minutes. It would be nice to hear other perspectives. I see Joanne saying that qualitative data is important based on feedback from direct supply. Here being health workers, the donors also need to invest more on the trendy methods of family planning, an example being condoms to target the adolescents. Thank you, Joanne, for that. Sandra says there needs to be a shift towards paying attention to information shared by the users of health services. Evidence now demonstrates that quality of care can best be defined by those who use the services. During yesterday's community session, Pakistan presented a success story from a listening approach they applied, engaging women and girls on what quality family planning services products look like. And the government is now included a citizen-driven accountability process in family planning service delivery. I think that speaks a bit to the previous questions, but also to the question that we are talking about, what investment? We need more investment in citizen-generated evidence. Thank you so much, Joanne and Sandra. Anyone else who wants to chime in before I move to the last? Kate, it's okay. She can be part of the session. Nowadays, this is common. So I see that a lot with my son. So it's fine. Let her just be part of the session.
Sorry.
Yeah. Anyone else who wants to come in and say, give their opinion about that? Whose evidence should we be looking for? What type of, what should we be investing in? Should we be investing in what we sit on this side of the divide and plan for? Or should we be investing in what the people, the users actually want at the end of the day? Frank, do you want to say something?
Okay, thank you. I think maybe I agree with you to a certain extent where you say that the users of the commodities should be considered. But then also the challenge is, I think maybe they also need information. But it probably just my contribution is that the implementers sometimes are to blame as well. Because the implementers then play a role between the users and the donors. So in terms of involving or engaging the users is the responsibility of the implementers. If the implementers, when they're interacting with the users, let's say adolescents, for instance, over a period of time, they'll definitely know which method is most preferred among the adolescents or among women of childbearing age. And then using that information, they can actually advocate to the donors to say, okay, these other methods probably that we are producing are probably not something that is relevant in our context because of A, B, C. So probably what is also important, apart from that, just using the quantitative data where you look at the trends in terms of what is being used, what is the most common method, there's then also need to conduct some regular, qualitative data collection with the users of those commodities. It could be adolescents or women of childbearing age to find their views to say why probably they are preferring certain commodities than others. Is it because probably there's lack of knowledge? Then if probably it's about lack of knowledge, then it goes down to the providers as well, like what someone said, that then the providers should then provide adequate knowledge so that they can be able to give or to get choice of, to get a commodity of their own choice based on the reliable information that they would have got from the providers. So at this point, I think I would just want to say I'm rushing into another meeting that is starting at 4. I'm starting in 3 minutes time, which is 4 p.m. this side. Thank you so much.
Thank you. You have also summed up. We're also running out of time. Thank you so much, Dr. Frank. We also have 3 minutes, which I think it's important. I'm hearing, I see we can go over by 5 minutes. I want to read what Mary has written. I think we still have gaps in data, poor quality or incomplete data on the very basics. Very true. Stocks, health worker skills, youth-friendly services, times and spaces appropriate for school-going girls and boys. I think that's a challenge that has been going along for a long time. And it cannot be overlooked. I think it's important that that needs to be refocused. Poor quality data does not really help at the end of the day. And I agree with what Dr. Frank has just said. Sometimes the implementers, being the conduit between the donors and the users, sometimes we don't pay attention a lot to what the in between, what are the views, what are the responses. A lot of times we want to use checklists and basically just pick data based on what we think or what we have planned from start. We don't really do like adaptive programming to actually want to understand what is exactly going on, why are trends changing, and what are the opinions of people. And what I'm hearing from Dr. Frank is that it's important that there is set aside resources for that exercise from time to time to just do some reviews to understand what exactly is really going on with people, basically hearing people's perspectives and the like. I don't know whether there's someone with a last minute before I sum up what I've heard from this interesting discussion. And I must say I'm very happy at least to see smiling faces agreeing to some of the things that I hold very dear, because I feel sometimes, a lot of times we do things, but we don't make a stop at some point to ask ourselves whether that is what we should be doing or we should be doing something differently. Anyone who wants to chime in before I do a summary of what I've heard from Kim, do you want to say something from what you've heard from each and every one of us? You've not said a word. I know you're very busy on the background.
Sure. It's hard for me to do a really thoughtful synopsis, having to work all of the tech. But one thing I did just want to quickly highlight, and that I just put in the chat box, is that both Angela and I were fortunate to be able to join the USAID consultation, mostly with their own staff, but a few other research partners, looking at research priorities and social and behavior change research. And a lot of what you all have been raising were also flagged as priorities and things to unpack there, from needing more data that actually tracks young people throughout their life course. I think that was one of the comments that Judith made, to really this idea around what was said numerous times around, method choice is often very limited in a certain context, and are, users actually even able to make an informed choice if the one thing that they can pick between is an injectable or a pill or something like that. And really, truly, what does it mean when women, girls, and other users have access to a full range of methods? What would then they choose? So just saying that I think a lot of the discussion here dovetails and can inform some of the conversations that are happening at USAID on these issues, and we would be happy to even pass some of that feedback along to our colleagues there for that audience. But Angela, I will leave it in your capable hands to do a summary of some of the major themes that came out, as my attention was in many multiple places during this conversation.
Thank you, Kim. I think it's true. What you said is exactly what we had in our consultation. And I think it speaks around the same issues that we've talked about today. Maybe to summarize what I've heard is that qualitative data or lived experiences of people, the realities of people count as evidence still, just as demographic data or quantitative data is, and so should be considered because it's the narrative stories that really speak to what the numbers mean. That's what I heard from a lot of us. I've heard something new from Mary that I think it's something that I would want also to really follow through to find out around using social media to establish some of the what people are saying, and especially cohorts or groups of people with commonalities. And a good example that she gave is the adolescents. What I heard is that opinion leaders are crucial. But we need to be very, they're important, especially because they are trusted by community, but we need to be very keen to check that they are not passing their own individual agenda. But in some spaces, we know that they are trusted leaders who really speak, and they are part of the community, and they speak toward the community. And they could be influencers in some of the key things and maybe push the agenda to the higher policymakers and the like. What I also heard is that looking at what evidence that donors should be looking to invest in. The donor should be looking to invest in some of the things around data quality. There should be around the implementers, what is the discourse between implementers, the users, and donors lies a lot with the implementers, and they need to be able to pass the right information and ensure that that information, whatever is coming from the communities, is really what is being responded to or funded. And so there needs to be a time for them to really listen to stories and reviews of what people are saying about what is they are investing in. I've also heard around issues around investing in aspects that are really key, or what are the trending topics, like the condoms that Joanne gave an example. I've had aspects about funding for qualitative, for views and perceptions of people around family planning and the like. And I think I've had investments in longitudinal data, not just looking at a one time of data, but really like along the continuum to understand what are the changing trends and the like. I think I'll leave it there. There's aspects about funding the supply chain data and all that. So I think I've had a lot of good things, but most importantly is that data coming from the users is as critical as data that is coming from the implementers and the donors. And so it's important that whatever is being planned for, there should be a co-creation of what is going to be implemented or funded for at the start of it all. And that's, for me, that's what I heard, is that is what is going to really make it count at the end of the day. Otherwise, we'll keep on doing things the same way and expecting different results. And I don't think we'll be different from the definition of madness as I hear. So I think at that point, I want to pass it over to Kim again, and I want to say thank you so much to really just hear your opinions about what did you think about the session. So if Kim, you can allow us to the shared slides with the faces on it so that we can hear what the participants think about this session. Yeah, and going forward, I'm happy that we've shared our email addresses. If you want to keep the conversation going on, I'll definitely reach out to some of you. So Kim, if you could do that. And again, just as we said, at the top of the Zoom window, click on the view options. Again, click on annotate and on the stamp. And then this time click on the art and gauge your satisfaction with the conversation by clicking on one of the faces. Are we done, Kim? Are we still clicking?
I think we can call it. Thank you so much, everyone. I'll let you wrap up, but it was really a pleasure to be part of this session and listening to the dialogue. Happy to see some of the connections made, and I personally do want to follow up with several of you afterwards as well. So thanks so much.
Yeah, let me echo Kim's words. Thank you so much. It was nice to see your faces, your smiling faces. And I see people are saying that they are satisfied with the session. It was interesting. So thank you so much for making it interesting, because I think you made it interesting by your contributions. And let's keep sharing the conversations around the different spaces that we find ourselves in. And I think at the end of the day, we'll get it right. So thank you. I think we are now going back to the breakout session. And as I said, I'll definitely reach out to some of you have shared their email addresses. Thank you.
Thank you, everyone. Have a great day.
Thank you.